I'm Scott Anderson. Welcome to Health Focus. December 4th through 11th is National Influenza Vaccination Week. The Centers for Disease Control publicizes this event as a way of preventing a potentially serious, if not fatal, condition. Although we think of the flu as an illness that inconveniences us a little bit, it's actually a potentially very serious, if not life-threatening condition. In fact, each year in the United States, tens of thousands of people die of influenza-related complications. Fighting the flu can save lives. As we explore influenza vaccination, we're pleased to have with us today Dr. Greg Warner, an infectious disease expert from North Bay Medical Center. Dr. Warner has volunteered to come on Health Focus and discuss influenza prevention techniques relative to this very important Awareness Week. Welcome, Dr. Warner. It's a pleasure to have you here.
Thank you for having me.
Maybe you could tell us a little bit about how you got into your field of expertise, infectious diseases, and how that came to be a focus of your professional career.
Sure. So as I went through medical training, the one theme that always interested me the most was the infectious component, because it was like a chess match between the organism you're trying to identify and diagnose, and then the treatment modality you're trying to implement. I love working with every medical and surgical field of medicine, and unfortunately they all have the risk of infection, and so that to me was always a draw, because I get to work with so many different individuals in the field.
Great. Well, let's get right into it with influenza. I think sometimes people don't appreciate what a serious illness it is. They say, well, I've got a touch of the flu or a little bit of the flu, but actually full-blown influenza is a very serious condition, isn't it?
Absolutely can be. People, like you just said, often will think of a really bad cold as a flu, and they'll just say, I had a really bad case of the flu, but I got over it. And so they think that it's not a big deal and that they really shouldn't focus on it. And like you said earlier, they don't really realize that there are many people who can die from complications, that you can lose significant time off of work, and there can have an impact on family as far as finance and also the health of the family around you.
Right. You know, I've seen statistics as high as 60,000 plus for people who die from influenza every year in the United States, and I've seen statistics as low as 6,000. The common figure seems to be around 20,000 a year, but I believe that it's really hard to get data on this, isn't it? Because death certificates don't always list influenza.
Absolutely. We're at the mercy of how well this information is reported, how well death certificates are documented, and so we don't have an absolute firm grasp. So we're all basically going on estimates that are provided to us from the Centers for Disease Control. And like you said, the numbers can range from the low thousands up to 20,000 on average year. Just this past year, in 2017, we did see a season that ended up with just under 80,000 deaths.
And historically, of course, we've seen complete catastrophes occur with the flu, most notably the Spanish flu, which occurred around World War I. And if I'm not mistaken, actually tens of millions of people perished from that, and the total number of deaths actually exceeded those who died in combat, I believe.
Absolutely. I think the last estimate that I saw said about 50 million people worldwide had died of complications from the Spanish flu, if you will. It taught us a lot. It taught us what could happen if we're not prepared. It taught that we need very good communication between the local health providers, hospitals, different branches of public health. It taught us the importance of our infection control practices, isolation of patients, masking, hand hygiene, washing one's hands. On top of that, it taught us the importance of surveillance, monitoring numbers and reporting numbers so we can see where the needs are and where we can focus our efforts.
And of course, we've seen a few scares. For example, respiratory epidemics coming out of Asia associated with swine flu, I believe SARS a while back. Do you think we're still at risk of an epidemic that could occur similar to what we saw in World War I?
The risk is there. I think the risk is certainly higher in resource-poor areas of the world where public health interventions and infrastructure is not strong. Here in the U.S., we can certainly see a catastrophe. Not quite to the level, perhaps, where it was in World War I. Our public health infrastructure is better. We have better infection prevention efforts. We have medical technology that's advanced enough that allows us to produce better antiviral medications and vaccines.
And of course, around the turn of the 20th century, around 1900, infectious diseases were in fact the most common cause of death.
Correct. Yeah.
And now we see more deaths due to chronic diseases of old age. But turning to the subject we're on today, the flu, how can a person tell the difference between, say, a common cold and the flu?
That's a great question. So we often think of the two having some commonalities. So runny nose, sore throat, cough. You could have a mild headache from sinus congestion as well. But where that similarity ends with flu, you tend to see high fever, body aches, fatigue. That can be much more severe than with the cold, and the symptoms can actually last longer as well.
Yeah, I remember 10, 15 years ago, I actually did get the flu, and I was surprised at just how completely out of it I was, just with the muscle pain and the fatigue, the cough. It's just a totally miserable condition, certainly one that we want to prevent, even if it's not a matter of death. So turning to our situation here in the U.S., tell us about the efficacy of the flu shot that most people might get. Does it really do a good job in preventing the flu?
It does a good job of
Okay.
preventing the flu. So the efficacy can range from year to year. On average, we see an efficacy of about 40%. We've seen a variety of numbers as well. Just going back to 2015, we had a particularly rough influenza season. I think the vaccine efficacy that year was about 19%, but 40% is average. But still, 40% is better than no protection at all.
Absolutely. I've seen some figures that suggest as high as 60%. Right?
It can. In the past decade, there was one year where we had a 60% efficacy.
Yeah. And of course, the flu virus mutates, so that's part of what complicates this. But tell us, just for the benefit of our audience, exactly how a vaccination works, because
Sure.
I think some people don't fully understand the process.
So with the idea of a vaccine, we're introducing a foreign material, a protein,
Right.
with the vaccination, and it's allowing the body's immune system to ramp up its defenses and recognize that protein. So the next time the body sees that protein, which typically is on the surface of a virus, it'll attack it more effectively, and thereby lessening the severity of the illness and also shortening the duration of the illness as well.
Okay, and we have different kinds of vaccines. We have, for example, inactivated compounds that derive from cellular markers on the surface of a virus, for example, or a bacterium. And then we have what are called live vaccines. So can you explain the difference a little bit and tell us the flu shot, for example? Tell us where it falls in terms of this general categorization.
Sure. So with the flu shot, we have two types. We have the recombinant vaccination, which is mostly, actually, they're all injectable. And so they're basically comprised of proteins that are found on the surface of the flu virus itself. Then you have what's called the live attenuated virus, and that is basically a weakened flu virus that is administered, that has a semi-effect of priming and ramping up that immune response.
And the live attenuated flu shot is the nasally administered
Correct.
one, right?
That's correct.
So if you get an injection, it's not going to be a live virus.
Correct.
So that's important, right? Because a lot of people, for example, are concerned that they might actually get the flu from the immunization, from the vaccination, and that's not the case.
Absolutely not. It's a very widely spread misconception that someone can get the flu from the flu vaccine. The reality is one can expect some flu-like symptoms early on after they get the vaccination, where they might feel some muscle aches, they might feel fever, they might feel weak, but that's the body's immune system priming and getting ready for a real infection. It never really flares into a real infection. With the live attenuated, you would get the same response.
And in fact, that's what you really want. You want the body's immune system to kind of respond to this vaccination in such a way that when you are exposed to a real infection, your body can fight it off.
Absolutely.
So we have the essentially inactivated viral marker or molecules, proteins for the injectable immunization. Then we have the nasal live attenuated. That's kind of interesting. Is the nasal attenuated primarily for pediatric cases?
It can be used in pediatrics, so it's indicated for individuals who are aged 2 through 49.
Okay.
And so if people have problems with injections, they don't want a needle, or they're afraid of a needle, the nasal spray is an option. It is popular in the pediatric population, again, for those children aged 2 and above. But there are limitations with respect to one's immune system. If someone is immune compromised, we should not be using the live attenuated vaccination. If a patient is pregnant, we shouldn't be using live attenuated vaccine. And if someone has an egg allergy, of course, we can't use a live attenuated vaccine.
Is there a lower limit in terms of how old you have to be before you can get the injection?
Yeah, 6 months.
Okay.
So the CDC guidance for states that 6 months is the minimum age that we should start vaccine.
So is there any reason why anyone would really need or want to get the nasal vaccine other than just a fear of getting a shot or concerns like that?
Not really. It could be more of a preference.
Okay.
But again, the limitations with the nasal vaccine actually exceed the one of injection, just based on the fact that it is a live attenuated virus. So we have to be careful with people whose immune systems might not be able to fight off a potential adverse effect.
Perhaps someone who received chemotherapy, or perhaps somebody who was on an immunosuppressive medication for rheumatoid arthritis.
Correct. Our chemotherapy population are HIV patients,
Right.
for example.
It sounds to me like the shot is the better way to go in most cases.
It tends to be.
Okay. And let's talk a little bit about the populations in whom you might recommend a flu shot. In your practice, who do you recommend as a reasonable candidate to receive the flu shot?
All patients are reasonable candidates to receive the flu shot, unless they have an egg allergy or unless they've had some allergic reaction to a flu shot in the past. Then we should not be offering. But barring those circumstances, I offer the vaccination to everyone.
Are there special populations in whom getting a flu shot is particularly important in your perspective as an infectious disease doctor?
Absolutely. So, historically, we've always focused on the very young and the very old because we want to make sure that these populations who already have a relatively weaker response to vaccination are protected as best as possible. Of course, our immunocompromised patients, like you mentioned earlier, are chemotherapy patients, patients who are taking medications that suppress their immune system. Those patients are also very susceptible to complications of influenza. And of course, those with chronic lung conditions, such as emphysema, COPD, asthma, they're at high risk of complications.
And tell us, Dr. Warner, how well are we doing in terms of, educating the public and encouraging people to actually get flu shots? Are we doing well? Are a lot of people getting flu shots? Do we have data on this?
We have some data. Some estimates range around 40% for American adults year to year, and that trend is fairly flat. We do a good job. We don't do a great job in getting the message out. I think that data is a little bit better with healthcare workers. We're able to better track that. We are better at emphasizing those efforts amongst healthcare workers. Numbers range from 60 to 80%, depending on the institution.
I guess it's a matter of whether the glass is 40% full or 60% empty. But, to me, that strikes me as actually a very low success rate. I mean, we have an intervention here that can save lives, tens of thousands of lives. It seems to me that we should be able to do better.
We should. It's an interesting time now because there is somewhat of a discordance between belief in science and belief in opinion. And so it depends on where the individual gets their information from, whether they believe a celebrity over their own doctor. And that's unfortunate, but that's the reality we live in, that opinion can matter.
And of course, we've seen this in other areas. For example, getting off the subject of influenza, in the vaccination for mumps, measles, rubella, the so-called MMR, there's a strong contingent of individuals who hold a deeply held belief that that immunization causes problems such as autism, and yet when subjected to rigorous scientific analysis, that has been found not to be the case. Nonetheless, the fear and the concern persists. And when people have these deeply held beliefs, it's very difficult to disabuse them of those opinions. And I found that when you discuss this with someone who's really against immunizations, often you get a reaction of anger, in fact.
Absolutely. I find some of the most useful methods in trying to convince someone of the importance is examples of normal, healthy individuals who never had any health problems having significant complications and sometimes dying of influenza. When someone's loved one dies from complications of influenza, that can be an eye-opening experience.
Right. And do you think, Greg, that we're also becoming a bit complacent? I mean, we were talking off air, and people who are older may remember epidemics of illness like influenza, measles, mumps, rubella. And we've kind of had such success with immunizations that we don't see the people whose lives are tragically altered the way we used to.
Absolutely. It's not present. It's not around us. We're not reminded of it.
Right.
As an infectious disease specialist working in the intensive care unit, I've had the unfortunate opportunity to see people die of complications of influenza, patients ranging in their 60s down to their early 20s. That picture I never forget.
Right.
But you're right. People don't see it, so it doesn't exist.
I think it's also worth pointing out that in getting a flu shot, you're protecting people around you. So perhaps, Dr. Warner, you could enlarge upon that.
Sure. So we have to think in terms of the patient-based benefits and, of course, population-based. The concept of herd immunity. When you vaccinate an entire group of individuals, the chance of a single individual getting sick is very minimal. So there is that major public health benefit. And of course, from the patient-based benefit, not dying of complications of influenza is a great benefit.
Do you have any ideas for strategies that we might employ to encourage people to get the flu shot so that we can increase that success rate to a higher level than 40% in terms of getting the shot?
Sure. It's about making it an understandable message. Of course, having individuals who have perhaps more recognizability, say to patients that they're getting their kids vaccinated, they're getting their family vaccinated. That may have a positive benefit and an effect on patients getting vaccinated. Of course, having just real, honest conversations with patients in the office as well never hurts either. So, of course, in this day and age, social media plays a big role, and we need to utilize those tools as well to get the message out.
Okay, so let me play the role of the devil's advocate and ask you a few areas that might be of concern to individuals who are reluctant to get the flu shot. How about Guillain-Barré syndrome, for example? Can you explain what that is?
Sure. Guillain-Barré is an autoimmune disorder that attacks the nervous system. And so people eventually will become paralyzed and can die of complications of paralysis with Guillain-Barré. We see a trickle of cases, we call it a background rate of cases every year of Guillain-Barré. There's been talk of an association with vaccinations such as influenza vaccine and Guillain-Barré. The data right now is not strong as far as an association. Can a person have complications such as Guillain-Barré from any vaccination? Maybe. But the science right now does not say absolutely that there is an association.
Right. And of course, there are rare complications. I've seen a case report, for example, of a septic shoulder joint from a poorly administered shot, but these are rare.
Absolutely.
So what if someone says to you, for example, well, I've never gotten the flu, so I don't need the flu shot?
Scott, if I had a nickel for every time I've heard that phrase.
Yeah, right.
It's a very frustrating phrase to hear, but it's a very normal reaction. So it's a good question. My response often to that is, to put it bluntly, I ask patients if they've ever had cancer before, if they've ever had a heart attack before, and if they've not, how do they know they're not going to have that? If you had the opportunity to prevent those events from occurring, why wouldn't you? Why wouldn't you protect yourself? And so, I have a picture in my head of a spouse of a patient of mine in the ICU that was dying on the ventilator from influenza-associated illness, and their response was, they were healthy. Why would they need a vaccine? And that was the answer.
Yeah, that's definitely heart-wrenching. When should someone get a flu shot? What time of the year?
So the recommendation at this point is late October. It takes about 2 weeks to generate an immune response after the vaccination. So given the fact that the season ramps up from November through late February, March, even into April some years, late October is the current recommendation.
Yeah, I got my flu shot, Greg, at the VA, and I know that it became available there October 1st. And I've always been of the opinion that you want to get the shot earlier rather than later so that you're protected.
Yeah.
But how about on the tail end? When's the last time a person benefits from the flu shot in terms of during the flu season?
So we used to have a very well-defined flu season that would go into April, March, April. Right. And that's changed. Ever since we had the H1N1 pandemic in 2009, we saw influenza trickling into the summer from the year before. And so it's never too late as far as I'm concerned to get the vaccine. If you're lucky enough in March to have made it through the season and never got sick, I would still recommend getting the vaccine at that point.
Okay. So I think we've covered why it is that the influenza vaccine is so important. And when I say vaccine, I'm really saying the same thing as immunization.
Sure.
The origin of the term vaccine, I think, really goes back to the first cowpox vaccines that led to smallpox. But it's the same process, right?
Absolutely.
Immunization, vaccine.
Yep.
Let's sort of broaden the discussion, if we could, Greg. What else can a person do to help prevent getting the flu? For example, I'm thinking of hand washing.
We're taught as kids to wash our hands before we eat. We're taught as kids by our parents to wash our hands to try and not get sick. That doesn't imprint on us well. We forget.
Right.
We use our hands for everything.
Right.
We touch a doorknob to open the door. We hold the gas pump to fill gas in our cars. We don't think of the 100, 200 or more people that have touched that same object before us. Hand hygiene is very important. And of course, along the lines of hand hygiene, we have to make sure that we are covering our faces as best we can when we cough or sneeze to try and protect those around us as well.
Right. And you know, one of the things that I think is rather sad is that physicians are not always the best at this. I remember going to a lecture years ago about hand washing, and then we went on break, and I noticed that a lot of the physicians were very lackadaisical about their own hand washing prior to going to the snack area and so forth.
Absolutely. What's really important to
Yeah.
also remember is with hand hygiene, it's not just soap and water, but you can use, for protection against influenza, you
Right.
can use an alcohol-based hand gel as well.
Purely anecdotally, I feel that this is getting better with the younger generation of doctors because at UC Davis, I attend on the inpatient rheumatology consult service, and they have signs reminding people about hand washing. They also have scrubs that you could use when you go in and out of a room, and I feel that it's improving, but I still think we have a ways to go.
Absolutely.
And how about face masks? I know that in the U.S., if you wear a face mask, you really stand out and attract a lot of attention. But having traveled to Japan, Singapore, and other countries, they seem to have a lower threshold for accepting face masks when they have respiratory illnesses. I think it's a good idea, but I just think it would be a hard sell in our culture.
I think there's a social stigma with wearing a mask. If you see someone out in public, on the bus, somewhere out in the park, you're wearing a mask, you're worried that they're sick.
Right.
Somehow we've come to this conclusion. In other parts of the world, as you mentioned, that have suffered from complications of SARS virus, for example, other swine flu, for example, in densely populated areas, it can spread like wildfire. So they've learned. We haven't yet.
Right. And in talking about other non-vaccine related ways to prevent the flu, you know, how about things, Greg, like nutrition, rest, adequate hydration? In your experience, how important are they?
Nutrition, rest, and hydration are great for health overall. But I've seen well-nourished, well-hydrated individuals who are healthy still suffer significantly from complications of influenza. So that alone will not protect one. Outside of vaccination and good old-fashioned hand hygiene and basic infection prevention practices, we're still all at risk.
Yeah, that sounds reasonable to me. And, you know, as our time begins to wind down, I wonder if you could tell us, Greg, a little bit about the future with respect to immunizations. For example, I know that there is research about a so-called universal flu vaccine. The Food and Drug Administration has suggested that perhaps we might be seeing that in 5 to 10 years. What exactly is that? And as an infectious disease expert, do you feel optimistic about the future of vaccine research? Are we going to get better vaccines?
I think it's an exciting time. I think that there's a lot of technology right now focusing on different ways of eliciting that immune response in the body with different types of vaccinations. The universal vaccine really is a vaccine that will allow one's immune system to recognize all strains. And that's what we don't have right now. We have to make educated guesses year to year of what are going to be the predominant strains. So a universal vaccine would be groundbreaking. Is it possible? I think it's possible. When I hear 5 years, I'm excited, but we'll wait to see.
And then, of course, there's the issue of the mutation of the virus. That's where the universal vaccine supposedly would find some epitope or marker that doesn't mutate. Is that more or less it?
That's correct. So every year there could be a slight adjustment in how the virus expresses certain proteins on the surface of the virus itself. And so if they can find one common thread amongst all viruses that doesn't change, that would be it.
Now, I know that North Bay is deeply invested in educating the public on health awareness and illness prevention, and that you have a very active program. of reaching out to members of the public. In fact, North Bay has been a fantastic supporter of Health Focus in terms of providing speakers and guests, which is something we really appreciate. Is there any place where our audience might turn either through North Bay or through other organizations like Centers for Disease Control to gain more information about influenza prevention?
Absolutely. So I think online there is a treasure trove of information and resources, but we need to focus on those that are vetted and are based in science and reality. So CDC is a great resource. So the website that I would use would be the www.cdc.gov/flu, FLU. And North Bay also has a link, www.northbay.org/flu shot. And those are good resources that we can use as well.
Excellent, and an excellent point that just finding something on the internet isn't enough. You want to have a reliable source. And of course, CDC stands for Centers for Disease Control.
Yes.
And, I'm a little bit reluctant to shake your hand because I don't want to spread any flu virus.
I've washed my hand and I saw you wash yours.
Okay. But certainly on behalf of all of us here at Health Focus, I'd really like to thank you, Dr. Greg Warner,
Thank you for
being an expert guest on the show to discuss a really important topic. The prevention of influenza. It's been a pleasure. I think we've really done some good here in scratching the surface, and I hope that you'll come back and visit us again.
Pleasure is mine. Thank you.
And remember that here on Health Focus, we focus on your health. Until next time, this is Dr. Scott wishing you the best of health. Take care.